Just imagine you wake up in a world where your healthcare is shackled in digital chains. And a leading healthcare titan, pivotal in the operation of hospitals and clinics nationwide, falls prey to a cunning cyber onslaught. Suddenly, the prescription you depend on becomes a luxury, payable only in full with no insurance discount. And your medical tests, well, they're in limbo. And your doctor's livelihood hangs by threads as medical billing systems crash. And lurking in those shadows, the threat of your most private data being auctioned off in the digital underworld. Well, imagine no more. This is not a dystopian novel. It is a grim reality unleashed on February 21st by the group known as Blackcat or ALPHV hackers. And they targeted Change Healthcare, which many of you probably never even heard of before. But Change Healthcare is a giant organization that was bought by United Healthcare. They orchestrate over 14 billion transactions per year. And Change Healthcare is a critical part of the U.S. healthcare system. It provides payment processing, care coordination, and data analytics services to hospitals, clinics, doctors' offices, and pharmacies. Now, this cyber heist didn't just disrupt, it is endangering lives, leaving pharmacies in a bind and medical practices on the brink of collapse. It's reported that in the United States, 1 in 3 of every patient records are touched by Change Healthcare's clinical connectivity solutions. 1 in 3. That's massive. If you've been listening to the news, you've probably heard about the effect of this hack on our nation's pharmacies. Now, Optum, it's a subsidiary of Change Healthcare, provides services to more than 67,000 pharmacies and care for 131 million separate customers. This ransomware hack meant that pharmacies were unable to receive insurance acknowledgement of a customer's insurance and the amount of copay, whether they were eligible to receive that prescription and have the insurance pay for it. So what this means is some people have had to pay full price for their prescriptions, no insurance discount because of this hack, or choose to go without life-saving medicine because they don't have the cash. Many pharmacies, though, have been willing to honor customers' previous insurance coverage, but they are being left in a cash flow bind because they've already paid price for those prescriptions, the meds on their shelves, and they are giving them to their customers in good faith, but they don't know when or if the insurances will recover and pay them. And these mom and pop pharmacies are particularly vulnerable to these cash flow issues. But while the media has adequately covered how this hack affects pharmacies, they have done a very poor job of covering the other ramifications of the hack, which might affect you and your healthcare provider. And it can even jeopardize care continuity because Commonwealth, who is a lifeline of medical record sharing, has terminated their connection with Change to be safe. So none of these records right now are accessible. These type of thefts are not just data theft. They threaten your life and needed healthcare. Now, this hack forced Change Healthcare to completely shut down access to 100 services that they provide. Just look at the number of medical and dental software affected. So here's that common well, right? For medical records, your dental network, maybe you won't be able to get eligibility for your crown. Eligibility enrollment, well, this is really big. This is how offices decide if you have insurance coverage for a visit or a procedure. Batch claims, claiming and remittance, and claims automation. This is huge, and I'll go into this in a minute. And here's even more. It affects third-party administration. Again, how healthcare providers get paid. Patient billing and statements. Many doctors' offices aren't even able to send out a bill. Clinical decision support. That could affect you if you are having special imaging. And even your vaccination record. I mean, wow. I own a small medical billing company, so I know firsthand the havoc this hack has had on my medical provider clients. So the clients we bill for use a variety of different electronic medical records and billing systems, but our clients who are on the local hospital's Epic system are the worst off. They're basically froze. They cannot send out any claims to insurances. They cannot check anybody's eligibility, insurance eligibility, when they come in the office. And what this means is they aren't receiving insurance reimbursement for the services they provide. And these practices often are small, independently owned, and they need an influx of weekly cash to be able to pay for their staff and overhead expenses. And they're worried. It's only been, it hasn't even been 3 years since the pandemic when they had to close down completely for a period of time. What is going to happen now? Well, you might just say, well, who cares? I mean, doctors are rich and they charge exorbitant fees. Well, you might be surprised to know that the golden age of medicine is over. The average doctor graduating from med school has $250,995 of educational debt. 73% of all physicians who graduate have education debt. And this debt is there before they open a private practice and have to lease space and get equipment. And as for how much they charge, that's really just inconsequential. Most physicians participate with all the major insurance plans. And what that means is they have a contract with that insurer. They agree to the insurer's fee schedule. So they could charge $150 for an office visit, but if the insurer's fee schedule says they pay $80 for that visit, then that's all they can collect from the insurance or patient. And that remaining $70 is written off as contractual insurance write-off. So they can put on their slip whatever they want for a fee, but that is not what they collect. And this is a little bit more dire because over the past couple years, staff salaries have really increased. Leases have increased. And unfortunately, insurance fee schedules have not really increased. In fact, in some cases, they've decreased. So unless the physician can produce more services, then they are going to collect less. Yet their expenses has went up higher. So all is not rosy for those new medical graduates. And you know that freezing of physician and hospital reimbursement, that can have a domino effect. They might have to lay off staff. Vendors might not get paid. As a medical billing company, we charge a fixed percentage of the net receipts of the practices for the month. So if they collect zero, then we get paid zero. Now, we're lucky because this hack does not affect all of our clients, but for some billing companies, that is not the case. And nobody can tell us how long this will last. And yes, if patient data has been stolen by these Blackcat hackers from Change Healthcare, then your identity may be vulnerable to theft. In a message posted on a darknet site, the hacker group said they stole millions of sensitive records, including medical insurance and health data from Change Healthcare. So, some point in the future, you may receive a notice that your data was breached. I wish I could say that this ransomware attack is unique. It is attacked by the massive size, but not as an occurrence. The American Hospital Association estimates that at least one hospital every week is hit with a ransomware request. And the Journal of American Medical Association Health Forum in December of 2022 found that the annual number of ransomware attacks against hospitals and other providers doubled from 2016 to 2021. And patients are dying because of this. An October preprint from researchers at the University of Minnesota found nearly a 21% increase in mortality for patients in a ransomware-stricken hospital. This hack just underscores the fragility of living in a digitized society. You know, as a prepper, I know a lot out there are worried about nuclear war, right? Well, that's not ever been one of my prime worries. My prime worry has been about hacking attempts on our infrastructure, be it our electric grid, our water system, or our healthcare delivery system. All of those are in danger of being compromised. Now, much of this is out of my control, but I urge you to encourage your government representatives to require more stringent cybersecurity for our country's infrastructure and healthcare system. Have a stockpile of prescription meds on hand. Ask your primary care if you can have a just-in-case supply, or gradually build up a supply each time you renew your prescription. And I encourage you to have a paper format of your important medical information. What prescriptions you're on, what vitamins you take, what are your dosages, who are your care providers, what surgeries and procedures have you had, what vaccinations have you had, what imaging tests have you had, and what are your lab results. All of that could be very important if something would happen and your medical records, the digital medical records your provider has, they can't get their hands on. Now, I have a healthcare summary sheet that you can print free of charge. Just watch the video at the end of this about the grab and go binder, and it will tell you how you can do that. I really, really encourage people to have this information at their fingertips. And I encourage you, be more understanding of the financial burdens of your pharmacists and your healthcare providers. In this digital age, our very health is being held hostage, highlighting our collective vulnerability. It is a clarion call for heightened cyber defense across our national infrastructure and healthcare systems. And it's a reminder for personal vigilance, stockpiling those essential meds, safeguarding your medical records, and extending some empathy to those frontline guardians of our health. We must prep as much as we can. So stay informed, stay secure, and let's advocate for a future where healthcare is shielded from cyber siege. And it wasn't this Blackcat. Watch this video to obtain your personal health summary sheet.